welcome. You're watching News Unlocked, news without the noise. At a time when coronavirus is wreaking havoc and continuing to upend lives in the country, in an attempt to contain the virus, most of us are largely confined to our homes. But that's not the case, that's not a luxury that frontline workers, especially health workers and doctors, can afford. Doctors, healthcare workers, medical staff members continue to lead this battle against the virus, putting their own lives at risk. In this backdrop, the Indian Medical Association is all set to release a report listing the number of doctors who have died either of coronavirus or of the pressure that is built up because of erratic world schedules and the stress that came with it. Today on News Unlocked, we unlock that world of the doctors who are on test and just how they are coping up with the pressures of dealing with corona and why that list has not been made public. It's our top focus on the News Unlocked today.
A recent report brings to the fore the toll that the coronavirus pandemic has taken on the ones fighting the virus head-on.
I haven't met my parents in last 2 months. I last saw them 2 months back, and I am living all alone here, managing my things all by myself. I have my exam coming up in October, which was, as it is, very difficult. On top of that, I have my project work, my thesis, my e-portfolios. Everything is going on.
According to this report, the Indian Medical Association data till April 15 showed that 106 doctors had already died in India because of the disease. And they had contracted the virus while tending to others who had it.
Very recently, we lost Dr. Anurag, a very young member of our medical fraternity who lost his life to this stress. Few days back to that, we lost our dear sir, Dr. Asim Gupta, who I have personally worked with. He lost his life to corona. Though these are the exceptional times, but we have to make the best of it. We were trained to become surgeons, to become dermatologists, to become cardiologists, anesthetists, even psychiatrists, but all of us are doing corona duties.
High viral load, repeated exposure, clubbed with poor quality PPE kits and masks in the initial days, erratic work schedules and pending salaries, all of it together has taken a toll on the doctors, both mentally and physically.
The IMA has indicated that they are in a process of releasing such a report that records how many doctors, nurses and healthcare staff we've lost due to the coronavirus pandemic. But we often forget, while they may be working like doctors under PPEs, just like you and I, they are also humans and their mental health also needs to be addressed.
Over the past few months, many healthcare workers have also flagged concerns over safety and long working hours, putting at risk the lives of those fighting the virus from the front lines, highlighting the lonely and deadly toll of those on COVID watch.
Now, while the Indian Medical Association is yet to come out with its reports on how many doctors have been affected during coronavirus, Dr. Rajdeep Sardesai, president of the Indian Medical Association's Kochi chapter, has actually collated data based on an elaborate media and social media search. It's not a scientific analysis. According to him, between 8th of April and July 9th, 108 doctors lost their lives due to coronavirus. Our reporter Milan Sharma spoke to Dr. Sardesai. Listen in to what he has to say.
So, Doctor, what is the figure that you actually arrived on after doing all your research?
Yeah, the figure that I have now is over 110. Over 110 doctors who have passed away. The title I used for this project or tribute is called Deaths During the Times of COVID-19. So I use the word
Okay,
during
so
the time.
you're saying that these doctors have passed away due to coronavirus.
Due to the pandemic. Now, the pandemic can affect you in many ways. The pandemic can affect you as a virus. It can affect your lungs, and your immune system can destroy your lungs and kill you. It can affect your immune system in other ways. Other organs can fail. It can kill you. You may get the virus and you may die from other causes. So just because you have the virus, it doesn't mean that the virus killed you. You may have died of some other disease. So where possible, I excluded those people. But from a news media report, without looking at somebody's medical report, it's extremely difficult to say that. And then there are many people who are working amongst COVID patients and died, and these deaths were attributed to COVID. Now, these were also reported not only in news media, but also in social media. So these were also counted as long as they seemed legitimate. If it could be, whereas on the other hand, if this person, let me finish this. On the other hand, if this person worked in a COVID ward and died of, let's say, some other known disease, and those people were excluded. You were asking something.
So is this the official data that is released by the IMA, or these numbers have been collated by your own self as your own data assessment?
Yeah, this is the result of my own work for the most part, but I did contact as many colleagues as possible to give me information. But to my knowledge, there is no official publication from any organization about this yet. I'm hopeful that everyone is working on it, because this is an extremely important bit of information as we plan for the future, because the pandemic is going to stay with us, and we need to know to preserve our healthcare resource. We can't replace these people.
Let's then go straight across to Dr. Rajan Sharma, National President of the Indian Medical Association. He joins me from Faridabad. Dr. Sharma, let's get it clear. Is there a report, or is there not a report, that between April and July, 108 doctors have died in the line of duty? And if they have, why is the IMA reluctant to reveal this report and come out with the details?
Rajdeep, good evening. First of all, I am speaking from Yamunanagar, Haryana. IMA was and will be never reluctant to release this data. Rather, I must share with you the first where a colleague we lost to COVID. Immediately, I had set up the National COVID Registry, which was functioning. It initially had its hiccups because the most important aspect of the resident doctors was missing into it. And now we have got a substantial data which is fully authenticated and includes all the practitioners of modern medicine.
Can you tell our viewers, because I want to know, can you tell our viewers, is it right therefore, can you confirm to us that 108 doctors, health workers have died in these 3 months?
It is not 108 doctors. As per the latest count till now, it is 97 doctors and 1279 doctors have been infected. That includes less than 35 years, 771.
Yes.
Above 35 to 50 years, 247. And above 50 years, 261.
Sir, I'm going to flash what you're saying. You are telling me 97 doctors, you are officially confirming to us that 97 doctors have lost their lives in India between April and July. Am I correct? And more than 1,200 have been infected by the virus.
Sir, Mr. Rajdeep, it is 92. As we speak, today one more we lost to COVID. And now we are working on a research document of the various causes attributed to the loss, because out of these, how many people have lost their lives in general practice and how many in the resident category. We are working on that data, and very soon IMA will come out with all the figures and the reasons behind this. So there is nothing that IMA is hiding from it. So it is not, we definitely support 92. It is our official data till today. And one life was lost today evening. So that makes it 93.
93 doctors, I'm asking again my producers to flash this, 93 doctors in this country have lost their lives in the last 3 months. Therefore, given this, how do you deal with this? What is your messaging to the doctors? Because this obviously suggests, and it's happening across the world, that health workers are among the most vulnerable in corona times. What's the message that IMA is giving? And remember, this presumably, sir, is those who you have information about. There could be others also out there.
See, Rajdeep, this data has a very wide base through all the 1745 branches across the country, and also all the resident doctor association of various medical colleges and top institutions in the country. This feedback has been taken by them.
And
I am having authentic data. Secondly, regarding loss, every loss is very worrying and saddening for us. But we are also saying, please ensure your own personal safety. And as I said already, a research has been attributed whether it has to do something with the donning and doffing, or with we need a change in the PP kits, about the sizes of the PP kits.
right, I want to understand, what does this show? Is it, what is the message that the Indian Medical Association has, therefore, for all your various chapters? Given that you are now telling us, confirming on air, that 92 doctors have died, or 93, you said one more dead today. What's your message to them, particularly in terms of many of them are worried about the quality of PPE kits? Many of them are worried about the conditions that prevail in many hospitals across the country. What's the message to those doctors? How confident are you that the doctors are not vulnerable in the months ahead? What protection do they have today?
First of all, I must tell you the hidden fact that many of our general practitioners have also lost their lives. So, personal safety is not to be compromised under any circumstances. Any patient who is not even symptomatic, you have to treat him as a symptomatic patient and take full precautions at your end. And as far as the PPE kits, we have started narrowing down to the doffing of the kit. When you take off the kit, which is known as doffing, and when the viral load inside the COVID ward, you're exposed, you carry the infection home,
right,
or you get infected, that needs to be worked on, because we are also working on a protocol. Is the PP kit sizing proper? Or we have to undergo a less cumbersome PP kit procedure.
Okay, so you're saying that those are protocols that you're going to look at, but you've given us very important information as the president of the IMA. I appreciate your joining us. This is the information that we were looking for. The official number is out. 93 doctors, and this is the first time it's coming out. Until then, earlier reports said 108. Now the official report, 93 doctors in the country have succumbed to coronavirus in the last 3 months. More than 1,200 of them have actually been infected by the virus. Now, the national capital, Delhi, with a population of over 20 million, facing a stream of domestic and international passengers, faced, remember, the brunt of COVID-19 pandemic from the beginning. By June, the caseload saw a steady rise. In such a situation, doctors and health workers were under serious pressure. Milan Sharma and Pankaj Jain get you this report.
With the spread of COVID-19 continuing unabated, the general advice for citizens is to restrict movement. Stay at home, but it's a luxury that most healthcare workers cannot afford. Attending COVID-19 patients and fighting the corona battle from the front lines, the healthcare workers are knowingly and willingly exposing themselves to risk every day. But at the same time, these doctors are battling on other fronts.
This corona pandemic has really shaken us to our core.
इस सफर की शुरुआत मैंने बहुत ही उत्सुकता के साथ और निष्ठा के साथ की, क्योंकि मुझे अपने देश और देशवासियों के लिए कुछ करने का मौका मिल रहा था और साथ ही साथ मैं अपने आप को भी आजमाना चाहती थी कि मैं 6-7 घंटे पीपीई में रहकर बिना अपने बारे में सोचे अपने पेशेंट की निस्वार्थ भाव से सेवा कर पाऊंगी या नहीं।
These are really difficult times for us, not just physically but mentally also.
Be it the government hospitals or those privately owned, doctors everywhere are facing the same set of problems. Long, strenuous working hours. Adding to the stress is the fact that they also have to constantly deal with the emotional outbursts of patients.
Initially, we felt that yes, we are warriors, we are doing something good and it's good, we are doing a noble deed. But while being at the ward, people are not really that sympathetic or they don't show much gratitude. I have been yelled at while being sick. During my last duty, I felt so sick that I was not in a position to go for the duty, but yet I went because I didn't have the liberty to miss my duty. We were so much understaffed that I was picking up the patient's urinal pot to throw it away while being yelled at by the patient. I tried explaining them that this is not a normal scenario where a GDA or any helper could help you, so that's why these things are coming up. But I doubt anybody understood that.
लोग सब डॉक्टर्स को एक भगवान की तरह मानते हैं, भगवान बना के ही छोड़ा हुआ है, बट वो भी एक इंसान है, उनकी भी छोटी छोटी रोजमर्रा की प्रॉब्लम्स आती हैं.
The emotional toll is made much worse as many doctors are themselves in a form of isolation. Most are staying away from their families to protect them.
4 महीने से लगभग 4 महीने से मैं घर पे ही नहीं गया, इसीलिए नहीं जा रहा कि मैं इधर एक्सपोज हूँ, क्या पता मैं एसिम्प्टोमेटिक कैरियर हूँ, हो सकता हूँ तो मैं घर जाऊंगा तो मेरे ओल्ड एज पेरेंट्स हैं उनको ना हो जाए. कितने घर के इतने काम पेंडिंग पड़े हुए हैं, काफी काम है जो अभी तक क्या पता मैं जाता घर पे तो काम वो होते.
The constant risk of getting infected coupled with colleagues lost to the pandemic is making the journey only harder.
Our colleagues, our administration have become a new family away from home. But seeing them succumbing has become a lot of despair to all of us.
Doctors are used to saving lives, but while they continue to do that, expecting a little gratitude isn't too much to ask for.
तेरी मिट्टी में मिल जावां गुल बन के मैं खिल जावां इतनी सी है दिल की आरज़ू तेरी नदियों में बह जावां तेरे गीतों में लहरावां इतनी सी है दिल की आरज़ू.
Let me go therefore to Dr. Suveen Shetty, head of the pathology department at the Hiranandani Hospital in Mumbai, because Suveen or Dr. Shetty, you've come out of Corona, you had Corona, you had to be quarantined and you've eventually come back, so welcome back. How difficult, Dr. Shetty, was that period when you were at the front line working and then suddenly one day you realized you too are affected by Corona?
Good evening, Rajdeep. Thanks for having me in your show. Yeah, you are right. 3 months we were working day in and out, Sundays included. I don't think so. There was a phase in recent past that there was a Sunday which was getting missed because we were working on this particular pandemic. And all of a sudden, one night, I should say, I had a severe body ache. I knew I had an infection, but trust me, I couldn't believe I'll get an infection because all the precautions I had taken, but somewhere definitely there was a breach on my part.
Mm-hmm. We just heard the IMA president tell us and confirm to us 93 doctors have died of coronavirus in the last 3 months and more than 1,200 have been infected. Do you believe that doctors are particularly vulnerable despite all the PPE equipment and all the other protection you may take? You remain very vulnerable simply because of the conditions in which you have to work.
So you go across the globe. Healthcare workers are at the highest risk, sir, because they are dealing with the patients who are highly contagious. And possibly a patient group which probably you'll not even know these guys would be infective. So doctors and the other nurses, the other staff in the hospitals or any healthcare setup facility would be at high risk, sir. Because at the end of the day, we know we are dealing with the infection, and which is very highly contagious.
So what kind of protection do you have? I mean, you are in a Hiranandani, a top-class hospital, so you perhaps have more protection than many others. What do you believe that there should be a greater focus on the kind of protection in terms of the protocol to be followed, the quality of PPE equipment that everyone must have universally?
This pandemic has come as a shock to the world, sir. So possibly the world per se was not prepared for it. We were not prepared for it. Our community was not prepared for it. So the protocols we learned over the period of months and weeks that this is how we should be functioning. So today, in the month of July, now we can say we know what kind of a treatment to be given, what kind of a measures to be taken, what kind of a protection to take for ourselves and for the patients. So in the last 3-4 months of this infection, we have grown knowledge, we have grown intelligent, we have become smarter. So I should say, initially we probably were not prepared. We didn't know what kind of a PPE would be conducive for this infection, to deal with this infection. What kind of a prophylaxis one should take. So hydroxychloroquine at one point was in shortage, but as you rightly said, Hiranandani Hospital could manage HCQs for their team who were dealing in this kind of infection, sir. But I don't think so everyone would have been that lucky. Right. Prophylaxis was important, chemoprophylaxis. The PPE, the safety measures was important. The infection control measures were important. So these measures came by learning and unlearning, sir.
Let me ask you in conclusion, a lot of stress, a lot of trauma, I know, for doctors. PSTD syndrome facing a lot of you. What is your stress buster? How do you bust the stress? How do you relax? How are you relaxing in these times, doctor?
Sir, the moment I see my son's face, that's the most relaxing time that I have. The family's face, the smiling faces of my friends, colleagues, and my family, it really helps in releasing the stress that one has in our work, sir.
So the best thing is to have a lot of people around you who are smiling, family and friends around you who are smiling, right? Or fellow doctors.
The fellow doctors whom you have been spending day in and out, sir, now. I mean, possibly we are trying to stay away from home and the family members, possibly because of the fear of taking infection back home. I've not seen my mom for last 3-4 months, sir. I speak to her on phone twice in a day, but I've not been able to meet her. But family,
That's true. I haven't been able to meet my mother either for several months, but that's the nature of the world.
I agree, sir.
Dr. Shetty, you've got to just adjust to it. You've been terrific. You're a frontline worker. You've battled corona. You've had it. And you've come back and bounced back and you're back at work. And that is really, it's people like you who in a sense are true corona warriors. Thanks very much for joining us. On News Unlocked today, our focus as always will be to open up and unlock those areas which you don't normally see on primetime news. We want to redefine primetime news by ensuring that you get news, real people without the noise. Thanks for watching. Bye for now. Stay well to all our doctors out there. Bye.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.